Hi, I'm Jane. I'm one of the Women's Health Physios here at myPhysioSA, and I work both in Adelaide and Mount Barker. Today we're going to talk about and show you a couple really good stretches that you can do if you've got any tightness around the hips, pelvis, or tightness or reduced flexibility of the pelvic floor muscles. Some of the symptoms associated with pelvic pain or tightness around the pelvic floor or the groin or inner hip muscles might be pain in the buttocks, groin, or in the vagina or internally. Otherwise, some people will get coccyx pain, other people might get pain down the leg. Other problems can include pain with intercourse or pain trying to use a tampon. Okay, we've got Jackie here today who's going to demonstrate the stretches. The first thing you want to make sure you are able to do is breathe using your diaphragm. If you're not sure about this, check with one of the physios when you come in and we can talk through it in a moment. So what the first stretch will involve, Jackie, is bringing one knee up towards you. Yep, you can start by hugging the knee into your chest. Good, often that will give a fairly good stretch in through the back of the buttock here or in the inner thigh. If you're finding that's not enough or you're not finding there's much of a stretch there, bring the knee out to the side. Thanks, Jackie. Excellent. So often that will increase the stretch. The third little point is to place your right hand on the inside of the arch. Now, Jackie's obviously pretty flexible. However, the aim here is to keep the knee in nice and close to the armpit. Yep, and gently allow that knee to sink down into the armpit, and you can pull a little bit further through the hand to increase the stretch. Now, in that position, you want to now come back and make sure that you're using your diaphragm. So I'll get Jackie to place one hand on her tummy, and I'm just going to watch her chest here. So when she breathes in, we don't want to see a lot of movement happening through the chest. Ideally, the tummy should expand and sink down. What that helps with is if the diaphragm's descending as you breathe in, our pelvic floor is going to relax. Okay, that same stretch can be done as what we call a happy baby stretch. So Jackie will just show you how you do it with two legs. Remember to get back into that diaphragmatic breathing rhythm and relax as much as you can as you hold the stretch. Another really great stretch or resting posture if you've got some pain or tightness around the pelvic floor or inner groin or hip area is this one here. We call it the butterfly stretch. It involves placing the feet together, allowing the knees to gently sink out to the side. Some people won't have as much movement as Jackie's got, so you can place a pillow under the knees either side, and that can help relax before you've moved into the stretch. Now remember, coming back into that diaphragmatic breathing pattern, so relaxed tummy breathing, so that you're enabling that pelvic floor to really let go and relax as the diaphragm moves. Now, there's no time limit for how long you should hold these stretches. Often it's as long as you're feeling comfortable. Try if you can to hold them for at least 30 seconds, building up to a minute, minute and a half. The aim is to be completely relaxed and really get into that rhythm of breathing. If you can, do them on most days of the week. Sometimes it's helpful to do it before you go to bed and when you're going to be in a relaxed state afterwards. Also remember, if any of it is causing pain or it's not feeling comfortable and you're not sure whether it's right for you, please seek the advice of your physiotherapist or a medical professional, or ask one of the physios here at myPhysioSA for further advice.